Hey everyone, we'll get started in a little bit, just giving a few minutes for everyone to join. While we're waiting, let me know where you all are joining from. I'm in Virginia, so it's starting to get a little chilly here. Just let y'all know there's a little bit of a delay too in the chat, so we're not ignoring you. It might just take a few seconds for us to see your messages come through. Oh, North Carolina, not too far. Y'all will see we have Krista in the chat. She'll be moderating and responding and interacting with y'all, sharing some links, so be on the lookout for her. Oh, all the responses coming. Oh, we have a Kenya. Florida, must be nice. I would love some Florida sun. California. We have a few Cali people. Awesome. Well, welcome everyone. How about, have you all been experiencing bow tie questions in school yet? Have you had these as practice questions? Your instructors pulled them up and practiced with you? These are definitely one of those new question types that can be a little overwhelming, but we're going to break them down today and make it a little easier. Hopefully. So we'll just give it another couple minutes until 2:30 Eastern time for everyone to join. As you all have questions or anything, just throw them in the chat and we will get to them. It might take a little bit, but Krista and I will be working through the comments to respond to you all and get you the answers that you need. Okay, so you've seen the bow tie questions on the HESI exams. Well, I'm glad some of you, it looks like some of you guys are getting practice with them, so that's good. I see. Okay. Awesome. Anyone about to take the NCLEX exam anytime soon? I know y'all are probably counting down the days till the semester break. Well, while we're waiting for everyone to join, let me get this up here. I'll introduce myself. So I'm Miriam. I'm one of the NCLEX content creators here at Bootcamp, and my focus is on the OB content. And I work with a bunch of other amazing nurses to help get you all the content you see on Bootcamp. And Krista is in the chat, so she'll be moderating and responding to comments. So feel free to throw any questions that you have in there. She'll be putting links to resources and other helpful links, so be on the lookout for her in the comments as well. All right, so if you guys haven't, if you go over to our NCLEX Bootcamp page on Facebook, you will see a link to join the group. It just answers some questions and you can share that group with your friends, and we would love to have you all there. All right, so let's get started on this bow tie webinar. So we are going to be talking about what a bow tie question is. We're going to talk about how it's scored. Everyone, of course, wants to know what are the chances they're going to see one of these on their exam, on their NCLEX exam. So we'll talk about that. And then we're going to practice one together. And hopefully I'll give you guys some tips to get through that. So before we go into, everything in this webinar, I want to touch base with you guys on what a bow tie question is and what it's really looking at. So it really assesses the clinical judgment. And I know a lot of this might seem like foreign language, but it'll make more sense as we go through the webinar. So there are 6 steps of the clinical judgment measurement model, and that's what is being tested on these bow tie questions. So we are going to be looking at how we recognize cues, analyze cues, prioritize hypotheses, generate solutions, taking action, and then evaluating outcomes. And we're going to break each of these steps down as we go through our bow tie question. Okay, so what is a bow tie question? Great question here. So parts of the bow tie, you're going to be given your instructions, and those are pretty standard. It's telling you to complete the diagram, and it gives you all the information you need. Then you're going to have scenario and data tabs. Now, the scenario is going to be like what's happening with the client. You might have data tabs that could be vital signs or head to toe assessment. That could be nurse's note, progress notes. Anything is fair game there. So you're going to look through all your data tabs when you get these questions. Then you have these headers that you see here. So you are given actions to take, potential conditions that they're experiencing, and then parameters to monitor. So each of these answer options on the side are going to have 4 to 5 choices, and then you'll have 4 in the center here for what their potential condition is. And then of course our answer spaces up here at the top. You'll drag your responses in there, and it's going to make what looks like a bow tie. All right, so will you see this on your NCLEX? So the question here, or the answer here, is that they show up after you've completed 85 questions on the NCLEX, or it could show up before as a pre-test item. So you might see it, but if it's before 85 questions, it's a pre-test item. And then scoring. The good news with these bow tie questions is that they're partial credit, right? That's really helpful. So you're not going to get, it's not all or nothing. So you're going to get 1 point for each correct, and you can get a total of 5 points. All right, let's talk through some strategies, because that's what's really important here to help you as you're taking on these questions and know how to approach it. So first, you're going to read the scenario, review any of the data tabs. So up here, you can see this one has a health history and vital signs. So you're going to review those in their entirety. As you read through those, I want you to ask yourself if each finding is normal and expected, or if it's abnormal and concerning. And as we go through the example today, I'm going to be asking you all to tell me if you think it's normal and expected, or if it's concerning. Then you're going to consider each of these columns separately. So you're going to take it on one by one and think of them either as a multiple choice question or a select N question. So in the center here, when we're picking our potential condition, we're going to pick that first. We have to know what the client's experiencing in order to know what actions to take and what parameters to monitor. So this is going to be a single best. You have 4 options, ignore everything else, and pick what is most likely occurring for this client. And then you're going to look at your left and your right columns and determine actions to take and parameters to monitor. And this is looked at as a select N, which just means you're selecting 2. N is standing for the number that the NCLEX wants you to pick. And here they want you to pick 2 from each. So you'll pick 2 actions and then 2 parameters to monitor. All right, so let's dive into one together. So our instructions are to complete the diagram by dragging from the choices below to specify what condition the client is most likely experiencing, 2 actions the nurse should take to address the condition, and 2 parameters the nurse should monitor to assess the client's progress. Okay, so let's look at our data tabs first. So we see that we're caring for a 34-week pregnant client, and the nurse reviews the health history and vital signs from 0900. So in our health history, we see a client who's 34 weeks pregnant. She's a G3P2 and is being seen in the obstetrician's office for a routine prenatal appointment. She reports experiencing mild lower abdominal cramping and small amounts of bright pink vaginal spotting yesterday evening. She also notes recent occasional dyspnea, and the client reports a mild headache for the last 2 days and not feeling the baby move very much today. Okay, now let's take a look at our vital signs. So in our vital signs, we see that we have a temperature of 98.2, our pulse is 80, respiratory rate's 20, we have blood pressure of 122/81, our pulse ox is 97%, and the pain is 2 out of 10 for a headache. All right, so we need to recognize our cues. That's going to be our first step. So this is where we're looking at what matters most here. So looking at this information, what things were concerning for you guys? What things did you see? What did we think about her being 34 weeks pregnant? Is that term or is that preterm? There's a little delay, so I'll give you all a second. So we have that she's 34 weeks pregnant. And yeah, so some people are saying baby not moving. I see that that's a concern. Okay. So we know bright pink vaginal spotting, preterm. Great. Okay, so our 34 weeks pregnant, we know she's preterm. So we don't really want to have a baby yet. We see that she is experiencing mild lower abdominal cramping and small amounts of bright pink vaginal spotting. What do you guys think of that, about that? Mild lower cramping, what could that be? Awesome. Everyone's agreeing that the preterm is a concern. So when we see that we're having cramping, that can indicate signs of labor. And this bright pink vaginal spotting, what do we know about that in labor? So we could have this as the cervix that faces, you have what's called bloody show, and it can cause this bright pink spotting to happen. Now, bleeding in pregnancy is always concerning and could mean many different things. But when we have this cramping, we have bright pink spotting, this is concerning for, I see preterm labor. Great. So we're concerned about that. Definitely need to look at that further. What do we think about this dyspnea? Are you all concerned at all about the dyspnea that she's having or this headache? When you guys see a headache in pregnancy, what do you automatically think of? What's something we might think of? Do you think about preeclampsia? So with preeclampsia, that's that hypertensive disorder that happens in pregnancy, right? And what happens is we have this elevated pressure and it's going to cause a headache. But her blood pressure is looking okay, right? It's 122/81. So I'm not too concerned about that headache. If her blood pressure was elevated, then we'd be worried, with the proteinuria, all of that. But since she has just a 2 out of 10 headache, her blood pressure is okay. I'm not super concerned about that. Now, she hasn't felt the baby move very much today, and I saw somebody had put that in the chat for a concern. But maybe maybe the baby's been in a deep fetal sleep state, maybe something we need to look at, definitely. But I'm not super concerned about that because maybe she just hasn't noticed the feeling yet, felt the baby move as much. What about in her vital signs? Do we see anything? So she had some dyspnea, so difficulty breathing. But what do we know as that we get further in pregnancy? What happens? That baby grows, takes up space, and our lungs can't expand, right? So we see that she has a slightly elevated respiratory rate, but it's just at 20, so not super, super concerning. And because we know that that baby is just in the way of breathing, it's kind of expected towards the end of pregnancy. We see her temperature looks good, pulse is good. So now we're going to keep all that in mind. We also see that she's 97%. So that makes me feel better about her dyspnea as well, right? Okay, so I see stable vital signs. For the most part, yes, we have stable vital signs. So let's take a look at our next step in this judgment model, which is the analyzing cues. So what could these findings mean? And so many of you already said preterm labor, right? But let's take a look at all of our other options as well. So we have placenta previa here. What do you all know about placenta previa? What are some symptoms of placenta previa? If you remember, placenta previa is when that placenta implants low over that cervical opening, as you can see in the bottom right picture. So it implants low over that cervical opening versus up high here at the fundus of the uterus, or the anterior side. So placenta previa, what does it cause? What are some symptoms? We're going to have vaginal bleeding, right? Yeah. Okay, so what is characteristic? Yes, so I see... I can't read. My eyes are blind today. The font is small, but somebody said we have painless, bright bleeding, right? That is absolutely correct with placenta previa. But she's experiencing some pain, right? She's having this contraction pains or uterine cramping, as she said. So I don't think that it's previa because of that. If she was having painless vaginal bleeding, or if it was bright red where we have that bright pink color instead, then I might be concerned that it's previous. And previas are also usually diagnosed earlier in pregnancy, so it probably would already be known. Our next option here is a pulmonary embolism. So what do we think about a pulmonary embolism? What is it? It's a clot, right? And what happens is that it's going to block here, an embolus in that pulmonary artery, going to block blood flow. Does anyone think that it could be a PE? What's making you think it, or what makes you think it's not? We kind of already talked through some of this. We have that slightly elevated respiratory rate, right? But again, that's expected at the end of pregnancy. And our pulse ox was normal. So as you see here in pregnancy, as that gravid uterus grows, that fetus grows, that uterus grows, it's going to push up on that diaphragm. And so what happens is when we take a deep breath, that diaphragm cannot move fully down to allow those lungs to expand. So I'm thinking PE is not likely. It looks like you all are still agreeing with that. So our last option here is an intrauterine fetal demise, or an IUFD. So an IUFD occurs when we have a fetal loss that happens after 20 weeks gestation. So she is after 20 weeks gestation. Do any of our findings indicate an IUFD? So she hasn't felt the baby move much today, right? So we definitely need to assess that, but it could just be a deep fetal sleep state. So remember, for this, we're looking for what is most likely occurring, most likely happening. And with our given information, I think what's most likely occurring is going to be that preterm labor, right? Because our vital signs are not showing us a PE. The bleeding is a little bit painful. It's not painless to indicate previa. And just because she has some decreased fetal movement does not mean that we have an intrauterine fetal demise. All right, so what is it? What's going to be our final decision here? What are we thinking? It's going to be, our preterm labor. Perfect. All right, so now that we have our preterm labor, we're going to go on to our next step here and figure out what are we going to do about that. All right, so this client's showing signs of preterm labor, and because of that, what are we most likely preterm labor based on all of our findings that are given are known. So now we need to determine what 2 actions that we need to take in order to help this client in preterm labor, okay? So generating solutions. This is where we decide what we need to perform or prepare to perform. So our nursing process comes into play here, right? Our ADPI, we're going to assess, diagnose. Now we're going to do this planning and implementation. You guys are already jumping ahead. I see cervical dilation. Y'all are on it. Okay. So remember that the NCLEX is a safety exam. So we need to find actions that we're going to take to keep the client safe in this situation, right? And this is a select N. So again, we're selecting 2 options. So we want interventions that are going to slow or stop the preterm labor, and things that will assess for labor, right? So that helps if you can determine ahead of time, what's my overall goal? And then you can look at each one separately. Okay, so QBL, quantify blood loss. What do we think about this? When would we quantify blood loss? Yep, perfect. So when the placenta detaches, we would, anytime there's a lot of bleeding, anytime there's bleeding, we're watching how much is happening. So this would happen in an abruption. It would happen in a hemorrhage. We'd be watching that, right? But is getting the quantified blood loss, she's only had a little bit of spotting, right? So it's not super concerning. And if we quantify the blood loss, that's not going to help us with these goals of slowing or stopping labor. It's not going to assess for labor, right? So while we might do all of these things, we want to pick the best 2, right? Which always makes it tricky, because if yes, all of these could be possible options that we would do. All right, so let's look at our next one, assess for uterine contractions. Do we want to do that? I've seen lots of people say this. Yep, Ashley's on it, assess for uterine contractions. Okay, so assessing for uterine contractions, we can put that client on an external monitor, those TOCO it's called, to assess the contraction pattern and frequency, right? Because we want to know, is she contracting? Are these cramping feelings that she's having, are they uterine contractions? So I definitely think this would be a helpful intervention for us to do. Okay, our next one is prepare to administer nifedipine. What do y'all know about nifedipine? What is nifedipine? More importantly, what is nifedipine in the OB world when you're in preterm labor? So nifedipine is a blood pressure med, right? We give it as an antihypertensive. But if you are in labor, it's what's called a tocolytic. So a tocolytic. And tocolytics are going to slow or stop uterine contractions, right? So that is going to help us stop or delay this preterm labor. Awesome. Yep. Tocolytic. You all got it. Okay. So I have 2 options here, but of course we need to always look at our other ones just to make sure. Prepare the client for an abdominal ultrasound. All right, so I saw some people were thinking that. Now, again, not that it's wrong to do, right? It can tell us how the baby's doing, especially if we were worried about an intrauterine fetal demise. It can assess where the placenta is, but that's not going to help us slow or stop this labor or assess for labor, right? So although it won't hurt anything, it's not going to be what we complete here. All right, our last option, prepare the client for a ventilation perfusion scan. Okay, when do we do this? What does this assess for? Obviously, it says, right, we're assessing for ventilation and perfusion in the lungs, those two parts of oxygenation, where air has to get in, that's ventilation, and then oxygen has to get to those red blood cells, and that's perfusion. But, and there's different diseases that we do this for. So let's look at this image here just to help explain this VQ, or this ventilation perfusion matching. So the first image on the left shows that we have a problem with ventilation. So anything that prevents the air from filling those alveoli, reaching the capillaries, such as fluid. So that could be like pneumonia. And then the image on the right is going to be, this is where we have a perfusion issue. So like a PE, it's going to block blood flow from reaching those capillaries. And what happens is then the lungs won't get oxygenated, right? So the client has no breathing and ventilation issues, but the blood flow is stopped, and that's preventing oxygenation to the blood. So a ventilation perfusion scan would help diagnose different things like the pneumonia. It'll look at that. It'll look for a PE. But remember, we were not concerned that it was a PE. And again, this isn't going to slow or stop labor, right? And it's not going to assess for labor. Okay, so take action. What did we decide? What are we doing here? We're going to do prepare to administer an ephedipine, our tocolytic, and we're going to assess for uterine contractions, right? All right. So next we have to evaluate our outcomes. So we need to reassess and see if our interventions helped. So this is going to be a direct measurement of what we did for this client, or for the condition. So again, this is another select N. We're going to pick two options here. So two parameters that we monitor. We might do all of these for a client, right? They might not be wrong, but we want to know what two actions are going to help us know if our interventions and our actions worked. So we need to know, did we slow or stop the labor, right? Did it get slowed or stopped? And we need to know if the fetus and mom are tolerating labor, right? So those are things that we want to look at. So let's go one by one down here. I see some of y'all already put in some great options, great answer choices. Hemoglobin. What's this going to tell us? Our hemoglobin is going to tell us our blood volume, right? Going to see if we've lost too much blood. It's going to let us know if we're low on those red blood cells. Great for clients with heavy bleeding, like postpartum hemorrhage. We would definitely want to monitor this if it was previa, right? Yeah, if we were quantifying blood loss. Good job, Jennifer. But right now, the hemoglobin is not going to tell us if we've been effective in slowing or stopping labor, or tell us how the fetus and mom are tolerating labor. So I don't think that's going to be an option. How about respirations? So same thing here, right? Our respirations are not going to tell us if we've slowed or stopped labor. Definitely something we monitor on everyone. It's not going to tell us if they're tolerating the labor well. Looking at cervical dilation. So I already see some people have put that in as an option. And here in this image, if you see, so you understand the cervical dilation and effacement, I want you guys to think of the cervix like a donut. So the hole in the center of the donut, your little hole, donut hole, as that gets bigger and wider, that's your dilation. And then if you squish the donut down as it gets flatter, that's effacement. So we definitely want to monitor this, right? Because we need to see if this client is progressing in labor or if we've slowed or stopped it. So as she's progressing in labor, she's going to get further dilated to that 10 centimeters. So I definitely think that we will be monitoring our cervical dilation here, right? We want to see, is she progressing in labor or did we stop it? Okay, fetal heart tones. So getting that fetal heart rate, what do we think about that? We can place this on the mom. We put this little monitor on the fetal back, an ultrasound monitor, and that's going to detect the fetal heart rate. And it's going to tell us, the toco up here is going to tell us the contraction pattern, and then we'll have our fetal heart rate to compare. And what is that going to tell us? It's going to assess how the fetus is doing, how it's tolerating the labor, right? Yeah, I see everyone agreeing that yes, we want to do this. So we want to get our cervical dilation and check our fetal heart tones. But let's check our last one just to be sure here. It's going to be our oxygen saturation. So oxygen saturation, we're going to monitor on everybody, right? Definitely important to know, but it's not going to tell us if we've stopped this preterm labor, if she's progressing, and it's not going to tell us how she's tolerating that labor, or how the baby's tolerating labor, right? All right, so let's check now all of our answers. We see that we're correct here. So we have a client in preterm labor. We'll give her nifedipine, a tocolytic. We're going to assess those uterine contractions. We'll check fetal heart tones and cervical dilation to see if our interventions have worked. So now you all are ready for these bow tie questions. I hope you all picked up some new strategies here to help you when you approach these questions, and you're going to do great. So remember just to take each part as a single question and answer it from there. And you all can find us. Krista will be putting these links in if she hasn't already. A course at bootcamp.com/NCLEX to get more questions, more bow tie questions, our cheat sheets, and some video walkthroughs of our case studies. And then you can also follow us on Instagram, TikTok, YouTube, of course, and our Facebook group. I hope that was helpful. Please let me know if you all have any questions. Krista's dropping all the links for you. You're welcome. All right. Well, if there's no other questions, I look forward to seeing you guys the next time, and keep a lookout. We'll be having a webinar coming up next week, so you can join in for that as well.